Hello everybody, this is Brad Johnson, senior reporter here at the Texan. I'm with Caroline Fairley, presumptive state representative out in HD 87, correct?
Yes, that's right.
That is for Price's seat. He's retiring.
Yes.
You jumped in the race and won the primary.
I did, thankfully, yes.
It was it really wasn't that close ultimately. You kind of pulled away.
Yeah, I think we won 61%.
Yeah.
So there were 4 of us in the race total. It was a hard campaign.
Yeah.
I think I had about 8 or 10 debates.
Yeah.
That happened the whole 4 months. So anyways, I was thankful that we won without a runoff. But
what was it? You're new at this.
I'm
what
very
was
new.
it like?
Well, I'll tell you, a lot of door knocking.
Yeah.
When I first got in the race, I remember thinking and sitting down strategically, like, how are people going to perceive my age?
Yeah.
You know, what's the narrative? How am I going to work this? And to be honest with you, a lot of it was just showing up, meeting with people, building the relationship. You know, I had a ton of meet and greets. I have 8 counties, so I traveled all over the Panhandle. I bet I had over 400 meetings by the end. I knocked on thousands of doors and really just sat down with these folks in the rural areas and said, okay, what are the needs you have that I need to know to represent you well? And through that, we just built, I think, a great relationship, and them trusting when I'm in Austin, I'm going to advocate for you and the needs that you have, because the Panhandle, you know, that's what I'm representing, and those are the needs that obviously I'm going to defend for. So. Yeah. I loved it.
Well, what kind of feedback did you get on top issues for your voters?
Top issues, border,
yeah.
Water, huge, rural health care. Those are the top 3 things that people were most concerned and frankly passionate about. So.
Well, when you get to the next session, you do have a Democratic opponent, so obviously not taking anything for granted, but it is a very heavily R district. So in the next session, what kind of policy items do you think you want to try and pursue to address those issues? Or anything else?
Yeah, totally. So, great question. A few things. Right now, I'm currently in this interim where I'm not the representative yet, so I'm campaigning still. I'm also able to start looking at legislation that potentially I might want to pass. So healthcare is huge. I work in healthcare, so I feel like I have something to bring to the table when it comes to, you know, transparency and PBMs and healthcare affordability. All of these things that are really tough topics for people and hard to navigate. So I'm really looking forward to working with other legislators that are also focusing on that. You know, Dr. Oliverson, James Frank, and several others in the House, and figuring out what is legislation that works well for our district. So healthcare is one. Water is huge. I met with Senator Perry just, I think, last week and talked about some things about, hey, what's important to my district? What are the things I need to know to advocate for this issue? Because it's really important to my district. And then the other part really right now is just building relationships. Like, there's going to be 150 of us in the House, and we're going to have to work with everybody. And so I've really enjoyed, I've spent a lot of time meeting with these other Republican legislators that I'm going to have to work with. And it's been that has been my favorite part so far, is figuring out what are the things that they know better than me, that they can give me advice. How do we bridge the gap, work together for the future of Texas and the Republican Party, and get, you know, good legislation passed?
You mentioned PBMs, pharmacy benefit managers, right? What's the big issue with that? Why is that causing problems in the healthcare industry?
It's a great question.
Can you put that into a couple minutes? I don't think
I can get that in a couple minutes. All I have to say is a few things. One, PBM's very complicated, so I can't even.
Well, what is that first of all?
So it's essentially in the realm of pharmaceuticals, and, you know, administering rebates, etc. Those things.
Kind of like a middleman, right?
Middleman, yeah. And in the gear I work in is more your out-of-network claims. So I feel like I'm currently still learning about PBMs and all of those things. But I'll just tell you, healthcare is so broad. It's very unique. And when we talk about government's role in healthcare, there's a line there, and we've got to be careful that we don't over-regulate when it comes to insurance carrier, PBMs, out-of-network claims, you know, physicians. Like, that conversation is just, we've got to figure out a way to all come together to the table to make sure what we're getting done is effective for constituents and people in Texas and the patients, but also protecting doctors. Like, we need to pay doctors well. They're important. And in my area, like I said, rural health care, that's really important. I mean, we are in a shortage of doctors and nurses, and figuring out a way to incentivize good physicians to these areas like telehealth, telemedicine. Those are huge, you know, things that we're looking at and that we already are doing. but I think we can expand those in a different way. So a few thoughts there, but it's very complicated.
Yeah, very, very. I covered it for a bit, and I just basically pushed it away because I couldn't handle it.
Well, you might have some good insight to give me.
I don't know about that, but on the water issue, that's another huge one. And if you look at the state water plan chart, we're gonna run out of water supply for the population we're projecting in 50 or so years. How the heck do you fix this problem?
So a few things, and look, I'm by no means the expert. I think Senator Perry is leading the charge with this. He's doing a phenomenal job. And a few things that I've learned. So for example, I met with a farmer in Stratford, and he's been farming for about 40 years. And we're sitting there in this coffee shop. He looks at me and says, Caroline, I don't know if my future kids or grandkids will get to farm because of the water issue. Like, I have now built my family business around this, and so it's a real issue to people that is going to impact our farmers and ranchers. It's really important. So desalination is something that I think we can look into. I think ways to conserve it better. We have a lot of water, but we don't have usable drinkable water, and you're right about the aquifer. It is depleting quickly, and so we've got to look long term in the next 50, 60 years, and that's another thing about running. Like, I'm so young. I'm going to be here in the next 50, 60 years, knock on wood. But
you want to be in the Texas House for 50, 60 years?
Well, maybe not in the Texas House. But
that's a long time.
Yeah, that's maybe not that long. But just involved. And so it's important to think long term when it comes to solutions with that. So.
And, you mentioned the conflict between government on the healthcare side. It exists on the water side as well. There's, whenever you build reservoirs, you're taking land from somebody, and some of them are farmers, right?
Exactly.
So farmers are getting hit two ways in this. How do you balance this? You balance the rights question.
Totally. Well, I'll tell you, private property rights are huge to me. I mean, we've got to protect private property rights, and so that's kind of my. Hey, this is in my mind when we're thinking about legislation to pass. We've got to make sure that we have that fundamental conservative position in protecting private property rights.
Caroline Fairley, thank you for joining us today.
Well, thanks for letting me be here.
Yeah.